Hello and welcome to another edition of Focus on Ghana, a very special one we're bringing you this time round, and we're going to look at the human person. From the cradle to the grave, you breathe, you eat, and you live your life as it is. Sometimes things happen, and when you break down and you are not well, people think that things have happened to you and you probably must have fallen foul of some laws. Yes, the laws of nature you may fall foul of. We are looking at a cancerous situation in our body. Sometimes you catch a cold, you cough for a period of time, and you think that it is what it is. But it may not be what it is. It might be something else. In this edition, we're looking at one of the cancerous situations that happen within the human body, the one that happens to the lungs. And there's a campaign to help us stay away from it, even if you have it, something to live your normal life and be good.
The diagnosis was a complete shock to me and my family.
You hear the word heart failure, you immediately associate it with heart attack, like you're going to die. I was very worried, I was frightened, I was upset because I thought I was healthy.
I had pains in my chest and I was feeling weak. I knew something was wrong and I had a cough that wouldn't go away.
Persistent cough or getting out of breath doing things that you were able to do would require further investigations.
I started getting breathless. I made a lot of excuses. It's okay, I'm a little fat, I'm a little heavy, maybe that's why I'm getting older.
If you spot the symptoms in yourselves or your family members, please contact your GP immediately.
Just because you have a condition doesn't mean your life is come to an end.
I was diagnosed with lung cancer, age 77. I'm now 85 years old, living proof that you can survive cancer.
Well, I'm going to continue looking after myself and I'm going to continue doing all the things that I wanted to do. I will get to the point when I can play with my children on the floor. It'll take time, but it will come.
Finding conditions early, such as lung disease, including cancer, and heart disease, makes them more treatable. So, if you spot the symptoms in yourselves or your family members, please contact your GP immediately. Don't ignore it.
And we'll be looking at the Be Clear on Cancer campaign. Our very special guest is Dr. Philip Abiola. He is clinical lead for cancer and of NHS Newham, and of course, GP Macmillan. Thank you very much for coming.
Great pleasure.
I hope you're doing fine.
Thank God.
Now, if you get me coughing now, would you be scared?
Well, I won't be scared, but I would like to be sure there's nothing else going on. Well, most coughs, I have to say, are not due to cancer. But,
Right.
like we said, you're not going to lose anything to get yourself checked because it could be cancer. That's why we're saying if you're coughing for any period lasting 3 weeks or more,
Right.
it could be a serious lung disease, which could be cancer. Especially if you are in the age bracket of 50 years
Okay.
and above, and especially if you are a smoker. But the campaign is for everybody.
Right.
I've seen people who are non-smokers and they developed cancer of the lung.
Okay.
So, but in essence, we are saying if you're coughing that is lasting 3 weeks or more, or even if you are breathless, it could be something, it could be a serious lung disease, which could be cancer. So we're asking people to go and see their doctors.
I would want to get to some basics here.
Yeah.
I want to look at cancer and get to define it, and I want to look at the part of the body that it affects, the lungs.
Yeah.
What do the lungs do for us? And if we say the lung is cancerous,
Yeah.
what does it mean?
Well, as we all know, the lung is the organ that maintains the whole body by supplying oxygen,
Okay.
which, as you probably know, we cannot survive without oxygen.
Right.
So when you breathe in, you're breathing in oxygen. And when you breathe out, you're breathing out the byproduct of what your body as produced after using the oxygen.
Okay.
So it's one of the vital organs of the body. And when we're talking of cancer, we're talking of abnormal growth,
Okay.
which springs up in the lung. And this growth doesn't obey the normal mechanism because it's abnormal.
Okay.
It starts producing things which is dangerous for the body. And we do know that if it's not dealt with properly
Okay.
and importantly, quickly, we know it's likely to lead into untimely death.
All right.
A quick one for that matter.
So how do I take care of my lungs so I don't get problems with it?
Oh, wow. Like I said, the first thing is don't even take up smoking.
Right.
And if you have taken it up, get out of it. Because we know
It won't be that easy.
it's not easy, but I always tell people, and it still happens. We tell people, it's either you choose your leg or you choose your smoke, because apart from cancer, one of the things smoking does is it can cause problems for the heart.
Mm-hmm.
It can cause problems for the leg. It can cause problems for almost every part of the body. So, and the damage that smoking does to the lung is unbelievable. And apart from lung cancer, actually one of the things the Public Health England campaign is other serious lung diseases like what we call chronic obstructive airway disease, of which many people will just say chronic bronchitis.
Bronchitis, right.
And it's one of the main drain of NHS today. But apart from draining the NHS, once people get COPD, they have almost had it, because it takes away their life. So even it doesn't kill them quickly, but they will be in and out of hospital. So
how do I know that I have a problem with my lungs?
well, the main symptoms is, especially in relation to cancer, is cough, especially if it's lasting more than three weeks, or breathlessness. For example, you climb stairs, you walk on the flat without problem in the past. You do your hoovering in the house without problem in the past. You walk in the garden without problem in the past. And all of a sudden, doing all those things is becoming an effort. You're getting distressed. Then it may be a sign of a serious
So one
lung
would
disease.
say that with age, certain things become difficult to do.
Oh, wow. I can tell you, by the grace of God, I've been a doctor for 30 years.
Wow. Well done.
And unless there is a serious problem, most people, even when they are in their 80s, 90s, they won't have problem breathing.
Okay.
They won't be coughing unless there is a problem somewhere. And apart from cough, apart from breathlessness, even wheezing, in which your breathing suddenly become noisy, it's
Okay.
like you are whistling. Like your breathing, people notice it's like a whistle that you're whistling. Could be a symptom of a serious lung disease, which could be cancer. If you're losing weight, which you didn't intend, that is, you're not on diet, you're not going to the gym to lose weight, and you suddenly discover,
You realize that all of a sudden your trousers is coming down.
yes, your ring is becoming loose, or people are telling you, why are you losing weight? Or you notice somebody, your wife or your husband is losing weight. You got to think this could be a serious lung disease, which could be cancer, especially if you are 50 years old and above, or you are a smoker, or to anybody for that matter. If you're getting unusually tired, tiredness, it could be a signal that it could be cancer. if you suddenly have chest pain,
Right.
you are developing chest pain. I saw one recently. That's all she had, all he had, chest pain. Or even if you had shoulder pain, it could be, all these things could be pointing to cancer. Of course, we know most cough won't be cancer. Most chest pain, most shoulder pain will not be cancer. But
Right.
you're only going to know
If you do a check.
if you do a check.
Doc, I can see and feel that most of our viewers will be asking, well, I cough for about a week.
Yeah.
A cough, phlegms come out.
Yeah.
Sometimes you see stains of blood in the mucus that comes out. Some people also think, well, tuberculosis could be one of those things.
And yeah,
And what would be the difference?
you're absolutely right. And that's the more reason why you need to get checked.
Okay.
Because it could be, especially for people coming from Africa, it could be a symptom of tuberculosis. And like I said earlier, we are not saying every cough
Could be cancerous.
is cancer, but it could be. But the only way we're going to know is when you get checked. In fact, one of the things we will do is to send you for chest x-ray.
Okay.
And one of the things we will actually put is, for example, I practice in East London, and people will tell you East London is like capital of tuberculosis.
Really?
Yeah, in perhaps in UK or even in Europe. So one of the things we will think this could be cancer, this could be tuberculosis. We will send you for chest x-ray, we'll send you to test, and that will tell us which is which.
Right. Right. So having felt that your breathing is becoming a thing of a difficulty, having checked and you realize that, no, I'm coughing for more than 2-3 weeks.
Yeah,
I am aged 50 and above.
yeah.
What do I need to do first of all? Do I just go to any hospital or go to my GP first?
Your GP. Don't go to hospital. Just go to your GP. And you're not going to lose anything. With our people, one of our greatest undoing, when I say our people, I mean the black African, the black Caribbeans, they were the Asian. They wait too long. They
Yeah,
wait.
but I go to the GP and all I'll be giving is paracetamol, or probably tell me, listen, go drink water and sleep. So why don't I do that? Why do I have to go there?
Well, but we know most cough, of course, will be due to virus infection.
Right.
Which, and you don't need more than paracetamol, taking a lot of fluid and the rest of it. But by times it is 3 weeks, and it's getting longer than that. Even if it's not cancer, it's better to get checked. It's better to be safe than sorry. I have seen both sides of the coin of people who present early, and that is what saved their life. And I've seen the other side of the coin of people who present late. I'm not sure if you have seen one of the adverts of the Public Health England of an elderly
There's an
black
elderly man,
who
black
was
black origin, who
Yeah.
checked, and I think it was 80, now he's 90.
Yeah, it's about 12, 11 years now. And I've seen both sides. I've seen it,
Okay.
in which the key is going to your doctor early enough. Don't try herbal medicine first. Don't say, I'm going to, the herbs works. I'm not saying herb doesn't work, but not for this kind of thing. Don't say, oh, I'm going to pray about it first. There's nothing to pray about. And I've seen it. I've seen in this country, people, even though we're talking of lung, I've seen people who have breast cancer, and in this same country, and they didn't come, and they've been sleeping in church until there's fungating. It's stage 4. People live until it's too late. I'm
So
a believer
as
myself.
early as possible, speak to your GP, get checked,
That is the key.
and you're on the safe side.
That's it's better to be safe than
I'm
sorry.
looking at a scenario like this. Unfortunately, I have picked up the habit of smoking.
Yeah,
I drink quite a lot.
Yeah.
And I would want to be safe. So every 6 months I go to my GP, check me. Would that be a safe thing to do?
Well, I won't encourage that you go to your GP to get checked every 6 months if you don't have any problem. But what I will tell all the viewers is, don't go into smoking. But if you get into the habit, your safest thing is to get out of it. Because it's not, like I always tell my patients who smoke, it's not a question of if, it's a question of when trouble will start. If you don't stop smoking. People will say, I know people who smoke for 30, 40 years, but what you don't know
is when it will start.
It's when they have problem. They don't come to you, they come to us. And we've seen so many lives lost through that. And part of this campaign, Beyond Cancer, is that the same symptoms of breathlessness could go for heart disease, could go for other serious lung disease. And if you go to, and apart from killing people, it causes disabilities. That's why if you go to the stroke wards in London today, you're going to find out that black people are disproportionately represented in terms of number.
Okay.
Go to any dialysis unit.
You have more black people there.
It's all full of black and Asians. So,
having mentioned the symptoms, we've looked at breathlessness and the other one.
Yeah.
Are these the only ones that would give you an indication you might be having a problem with your lungs, or there are other symptoms that you are being quiet on?
Right. I will go over them again.
Please
Apart from cough, lasting 3 weeks or more, breathlessness,
Yes.
unusual tiredness,
Yes.
wheezing in which your breathing looks as if you are whistling, chest pain or shoulder pain, or unintended weight loss, in which you are not dieting, you're not going to gym to lose weight, but you discover you are losing weight. All those could point to symptoms of lung cancer. And especially if you are 50 years and above, or even more if you are a smoker. But like I said, it could happen to anybody. I've seen people, non-smokers, develop lung cancer. So it can happen to anybody.
Well, if I live with 2 or 3 people,
Yeah,
very, very stubborn ones,
Yeah.
who wouldn't want to see the GP for anything,
yeah.
but I realize that these symptoms are pertaining in whatever it is that they do.
Yeah.
What do I do?
You
Do I
can't-
have to report them?
Well, I will advise
Because
you.
I might be invading on their privacy.
Well, I'm sure if you can never invade on your wife's privacy, or your husband's privacy, or your friend's privacy, or your parents' privacy. So which means if you see, what I always tell people, we are supposed to be our brother's keepers. If you see your dad, if you see your mom, if you see your wife, if you see your husband, if you see your friend, have any of these symptoms, get them checked, push them to go to their GP. And I have seen many people do that, and they are glad they do. And because at the end of the day, the grief will come to everybody, not just the sufferer, but the relatives. And why subject yourself and everybody to unnecessary grief or aggravation when it could be prevented? So I would say report them.
Yeah.
I would say convince them, push them, like many women do. They push their men. And even many men push their wives to make sure that, I've had enough. You need to go to your GP. And it's a common language that I've been ordered to come and see you. So
The problem with the lungs, is it related to the heart in any way? Can somebody who has a lung cancer or a lung problem
yeah.
have heart disease?
Oh yes.
How are they related?
Well, one of the things that, especially I would say in black people, if you have if you are a smoker, you are prone to all the three: cancer, heart disease, and serious lung disease, including cancer.
Okay.
And breathlessness could be symptoms of any of the three. Breathlessness could be due to lung cancer, it could be due to heart disease, and it could be due to serious lung disease that is not cancer.
What could that be? Because if there's a serious lung disease and it's not cancerous, what's the difference?
There are things like what I describe as chronic bronchitis.
Okay.
In fact, what we call smoker's lung, like emphysema, due to long time smoking, and this is relevant for Africans, especially those who grew up in the villages where they used to cook, inhaling smoke. I've been to village when I was young. I've been to farm, and I know inside enclosed space, we inhale a lot of smoke, a lot of fumes. Even inside the house, they put out what they call stove, and it's dishing out a lot of smoke. So one of those things could cause a sort of irreversible damage to the lung. And I always tell many of the chest physicians in London that they should always watch out for Africans or Asians who they are wondering how did they get chronic lung disease.
Right.
It could be the background in terms of where they lived before.
You're still with us on Focus on Ghana. In this special edition, we're looking at the Be Clear on Cancer campaign. And our special guest, Dr. Philip Abiola, is taking us into what the whole disease is about. I would want us to get back to him and ask what the campaign is about, the focus of the campaign. Yes, it's about people who are 50 years and above, smokers, people who are at risk around smokers and the rest of it. Dr. Abiola, the campaign, what is your focus?
Our focus is if you are coughing for 3 weeks or more, if you're getting unduly breathless, if you are getting unduly tired, you're having chest or shoulder pain, your breathing is turning to a whistle, or you're having unintended weight loss, going to your doctor early can be the key to saving your life, because we know that cancer is not what it used to be in the past, in which once you get it, it's a death sentence. We have lots of people now who will say, I had cancer 10, 15 years ago. But the key for them is because they went early to their doctors and they were diagnosed early. So what we're saying people is that don't say, I don't want to trouble my doctor. I would rather you trouble your doctor, because that could be the key to either you survive or live longer or not. The key thing to the outcome, one of the main keys to what happens to people who get cancer, is how early that cancer is diagnosed. And I've seen experience, I've had experience of people who came early and they are better off for it. And I've seen, unfortunately, the other end of people who came too late, and unfortunately, it was all grief for themselves and their families.
Maybe just a step back before we go to the other forms of the campaign you are undertaking. If, for instance, I unfortunately have my lungs cancerous, can it be cured? Or you just manage till I die?
I'm not sure I will use the word cure, but by definition, if somebody has cancer, after 5 years, even though we may not use the word cure, but it's tending towards that. And like that man said in the advert by himself, he had lung cancer more than 10 years ago, and he's still alive. And in fact, I've seen people, I've had experience of patient, my own patient, who had lung cancer and lived more than 5 years. Unfortunately, I've seen the other side of it, in which even when we diagnose it, this black person was still saying, oh, I reject it. I reject it. You know, the religious stuff.
Religious talk, yes.
I reject it. And I say, if you die because of ignorance, you're committing suicide. And you might even end up in hell. Because God had made the provision
for you to have
for
help.
you to have treatment. People, I'm a Christian myself, I'm a born again Christian. The Bible says, my people perish because they lack knowledge. And God says, everything I have created is good. Take dominion. Part of the dominion you take is knowledge. God will not invest in people like me for nothing. And if God invests in knowledge, if God gives the solution, and you refuse to take it, you're committing suicide.
Information is key.
Yeah.
When it comes to these things.
Yeah.
How are we getting the information drummed down into the people, apart from the media campaigns? What else are you doing?
Well, everybody has got a smartphone nowadays.
Okay.
And everybody's got Google. Just put "Be Clear on Cancer" on Google, and you will have more than enough information that you need. Google "Be Clear on Cancer," and I can assure you, every information you need, it will be there. And this campaign, I always tell, and you do it, let me comment, you're doing a good job for doing this kind of thing.
Right.
And we should spread it to our communities, to our churches, to our mosques, to our community groups, to our temples for our Hindu brothers, to synagogues, to everywhere. Just
so,
for our people.
If I am to ask you to give a direct message, look right in the eye of that very quote-unquote very stubborn black African Asian who thinks that I can live well even though there is the danger. What message would you give to the person?
The message would be, you only think you are in control because it has not come. If it comes, you will realize you are not in control. Save yourself grief, and even very importantly, save those who are around you, your relatives, your wife, your husband, your children, your parents, your friends. Save them the grief of untimely grief. That would be my message.
Well, Focus on Ghana is also happy to be a part of the campaign, being a vehicle through which we can send the information out. And they say a stitch in time saves 9. Better be late than sorry. Check, 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 and get to your GP as quickly as possible. 50 years and over, you smoke, you live around somebody who smokes, or even 50 years and younger, you live around people who smoke. If you're coughing for more than 3 weeks, if you are breathing heavily, you have those difficulties in doing the things that you were doing previously, please don't ever think you are safe. Run for help.
Even if you don't smoke.
Even if you don't smoke. Yes.
Even if you are an ex-smoker. Very important. Even if you don't smoke, or you are even an ex-smoker.
So the point is, don't be complacent.
Don't be complacent. You are not disturbing your GP. It's better to be safe than sorry.
Public Health England is running this campaign, Be Clear on Cancer. Our guest have been Dr. Philip Abiola, clinical lead for cancer, NHS New Home, and a Macmillan GP. Thank you very much for coming.
It's my pleasure. Thank you very much.
And to you, the viewer out there, thank you very much. Better late than never.